Hello and welcome to TVC Midday News. We'll start off with health stories. The federal government has received 10,000 doses of the Jynneos Mpox vaccine from the United States government. Executive Director of the National Primary Healthcare Development Agency, Muyi Aina, says the government will prioritize 5 states with the highest burden of the disease.
Declaration by the World Health Organization on the 14th of August made the current Mpox outbreak a public health emergency of international concern. With this, a lot of support and response is needed to flatten the rising curve of spread globally. Nigeria has now received 10,000 doses of the Jynneos Mpox vaccine from the United States government through the U.S. Agency for International Development to support the government's efforts in responding to the current Mpox outbreak in the country.
The arrival of 10,000 doses of the Jynneos monkeypox vaccine donated by the good people of the United States of America to the Federal Republic of Nigeria is a critical step as we mount our response and preparedness towards the virus.
Nigeria government has put together a vaccination plan. So there's a plan how to use these vaccines effectively, how to make sure we get the most effect out of this 10,000 vaccine donation. So that's very much why Nigeria was chosen to receive this first batch. We will continue to work with Nigeria on efforts to stop the spread of the monkeypox illness, and we will continue to look at how we can help Nigeria.
All the partners here say it is important to ensure that all countries are supported to fight the spread of the virus on a global scale.
The vaccine that Nigeria just received today is a safe vaccine. It has been used for smallpox, but they have shown some efficacy with the Mpox. And we believe we should be informed by our science and not amplify misinformation.
The MPHCDA says it will prioritize 5 states: Bayelsa, Edo, Cross River, Lagos and Rivers states, who have the highest burden of Mpox.
The highest number of cases, many of them are in the south. But of course, we're going to have to work with the states to develop state-specific plans, to make sure that the vaccine...
The vaccine is a 2-dose primary series for use in persons who have never received the smallpox vaccine, and a single booster dose for those who have been previously vaccinated.
Here in Lagos, the State Commissioner for Health says there is no case of monkeypox, but the government finds it very important to deploy strategies to keep residents safe from the contagious viral disease. Senior correspondent Jacqueline Ogo has more.
The World Health Organization has declared monkeypox a public health crisis. But Lagos State government says, although it has no confirmed case of the disease, it is setting up the stage to safeguard residents against the highly contagious Clade 1b monkeypox virus spreading in Central Africa. The government says it will not take chances because Lagos has a huge population and it is also a major trade center for African businesses.
It's very difficult to distinguish between a bad case of chickenpox and Mpox. I have people on the table here with me who are specialists in laboratory diagnosis of Mpox. We have very, very elaborate equipment in Lagos in about 4 sophisticated laboratories that are able to precisely determine whether the sample they receive from a suspected case is Mpox or is chickenpox or is any other pox-like illness.
The Commissioner for Health says, although the United States has tested and tried the Bavarian Nordic smallpox vaccine, which is the only vaccine approved in the US and Switzerland for the treatment of monkeypox, it will not be recommended or dispensed in Lagos State without thorough home-based research by key government agencies. On the sideline, Lagos State Chief Epidemiologist gave details of the symptoms of monkeypox.
Mpox, the rashes are bigger, they are more painful, they are found all over, starting from the face, down to other parts of the body, the genitals.
According to experts, the most common way through which monkeypox spreads is by body contact and sexual intercourse between men. The major strategy for curbing the spread is isolation. Lagos State government says it is working on ensuring spaces are available for that if the need arises. Jacqueline Ogo, TVC News, Lagos.
The situation is not the same in Cross River State as the Commissioner for Health, Egbe Ayo, announced a new case of Mpox in Obodo local government area, increasing the state's total case burden to 5. The person is female from Okoshi village, and state authorities are investigating her travel history, including a recent trip to Ebonyi State. To mitigate further spread, the State Ministry of Health has activated the Incident Management System, promising thorough contact tracing and public education on preventive measures. Cross River State has a history of monkeypox, with 4 cases reported in February and March.
A sample was taken and sent to the National Reference Laboratory, and the result came out on Saturday positive for Mpox. So that is the first case we're having in this current outbreak period in Cross River State. Children are the target in this current episode, where 70% of cases are children under 10. So crowded, schools, environment are very important areas to implement prevention measures.
This current outbreak of Mpox, we received the result on Saturday, this last Saturday, 24th of August. So that is why the EOC, Emergency Operation Center for Response, have been activated by the Honorable Commissioner for Health.
Now, Enugu State chapter of the Nigerian Association of Resident Doctors has joined the 7-day warning strike called by the association over the abduction of their colleague, Ganiat Popola, who has been in captivity for over 8 months. With this development, health services at the state and federal hospitals are being administered by consultants and nurses. Senior reporter Bamidele Ajayi has more.
On 26th of August, the national president of the Nigerian Association of Resident Doctors, Dele Abdullahi, announced a 7-day nationwide warning strike. The directive became necessary after an emergency meeting to press on the demands for the release of their colleague, Dr. Ganiat Popola, who was kidnapped 8 months ago. In compliance with the directive, Enugu State University of Science and Technology, Teaching Hospital Park Lane, NAD members are here on a peaceful protest. They are calling for unconditional release of their kidnapped colleague, improved security conditions in Nigeria, and enhanced welfare of doctors.
We are appealing to the government, the Federal Republic of Nigeria, to do their needful work and release our sister who has been suffering for long. Doctors' life matters.
We are talking to government, yes. We're also talking to every individual out there. A doctor is an essential duty personnel. We stand here for patients. So everybody should lend their voices to fight for the doctors. If there's no doctor in the hospital, how can illnesses be treated? How can you be healthy? So doctors should be a priority for everybody.
The warning strike seems to be taking toll on the public, as some patients have their treatment delayed or rescheduled because of the doctor's industrial action.
Since morning, from 7 o'clock, I'm here, and no doctor is working. So I cannot continue.
But gradually, some of them are attending to patients, irrespective of the fact that there are others that are protesting and raising issues for their kidnapped colleague.
Nigeria has been grappling with armed conflicts such as terrorism and banditry, among others. The Safeguarding Health in Conflict Coalition Initiative identified 19 incidents of violence against health workers in Nigeria in 2023. It also identified 43 centers in 2022, compared to 56 in 2021, in which 37 health workers were kidnapped, 7 others were killed, and health supplies were looted from pharmacies and health centers.
Bamitele Ajayi, TVC News, Enugu.